Many women and some men suffer from some form of vein disorder, and if you have veins on your legs, you may be wondering if this is just a superficial cosmetic issue or something more serious. Either way, there are solutions, and Dr. Michael Kunstmann is here for today's Mount Carmel Doc Talk. Welcome, Doctor. Nice to have you here.
It's great to be here.
Can you explain the difference between the two types of varicose veins, some that are more serious and some that are superficial?
The superficial ones are usually a little bit more on the cosmetic side of things. The larger, ropey varicose veins that many people will have will cause symptoms: aching, throbbing, heavy legs, sometimes some swelling or even some discoloration.
So that's a painful problem for some folks and a real medical issue.
No question. That's a progressive issue that can really lead to morbidity and loss of activity and the ability to perform at work even.
I never thought about that, but if your legs hurt, you're not going to want to walk or exercise, so that's going to lead to other issues.
That's right.
What can you do then for these folks that have varicose veins?
There are some conservative methods, and then there's some surgical methods. Conservative things such as leg elevation or stockings, sometimes ACE wraps even, can avoid procedures. Then there's some things where we can treat the veins with lasers. We can treat the veins with removal of the veins, and a lot of those procedures have become a lot less invasive.
This is a dramatic before and after, Doctor.
Yeah, there's some really impressive results by removal of the veins and treatment of the source of the veins.
You talk about ablation and Trivex. What are those?
Ablation is basically where we take a catheter inside of the saphenous vein, which is a vein that runs in the middle of your leg, and by blocking that vein or rendering it functionless, we've eliminated the source of why those veins are there to begin with. The Trivex is where we kind of take a light underneath the skin and visualize the veins themselves, and then use a device that will remove the veins.
Now, in the old days, and we're going back ways, they used to call it stripping, basically, right? They would take a whole vein section out of the leg. Is that common? Do you do it anymore?
Rarely is that done. The ablation procedures have pretty much removed that. By removing the vein, obviously you've removed it and there's no longer function of that vein. With the ablation procedures, you've rendered it functionless, pretty much removing it.
And can these veins come back?
Unfortunately, that's a possibility. By treating the source of the problem, we hope that would eliminate that chance, but there's always a possibility.
Spider veins, much less medically necessary to do something, but yet, some women are really bothered by these, and you can help that too. Right.
Injections with a sclerosing agent, which will render that vein occluded or damage it so that it goes away, or even topical laser can also help.
And in both cases, what kind of recovery is there for folks?
That varies from person to person. The sclerotherapy and then the topical laser therapy is really a quick recovery. Sometimes with the ablation procedure, you can get back to normal activity within 48 hours. With the Trivex procedure, that varies again from person to person, but that can be 7 to 10 days before you're really back to normal activity.
And how much of this is heredity?
It plays a part.
Yeah.
There's definitely a part.
Because I know even in my own family there are tendencies with that, but I didn't know how much, when you look at things that cause it, does excessive sports with heredity, what can bring these things on?
Multiple pregnancies, females, that's much more common in females, being on your feet all day long at your occupation, and obesity, unfortunately, also plays a part.
Well, for folks who want to find out more, there is a free information seminar that you are going to be hosting, and we want folks to know that because it is free, we hope they get out there. It's Thursday, October 27th. It will be at the Creekside Conference and Event Center in Gahanna, an information meeting, but there is a number there because you do need to register, so we invite folks to go. It is free, but they do ask that you register in advance. Lots of good information. Thank you so much, Doctor. Nice to meet you.
It's great being here.